Roger, thanks so much for coming on. So you've said that mindset is better than muscle, didn't you?
For sure.
Phrases. Why would you say that?
Because I think that's what gets you through everything. Like, if your mindset is not in the right place, then what can you do? Everything starts up there first. You know, when people say you need motivation in order to do stuff, or people come to me and ask me, what keeps you motivated? When I'm training, I don't even think about motivation. In fact, motivation comes after the training. You know, you feel euphoric, you feel great, but it's like having the mindset and knowing that there's something that you're going to get on the other side. It just sets you up for success always, you know. If it's not there, you're going to be like a crisp packet in the wind. You know, you're just going to go with wherever it's blowing, you know. And many people are like that. It's like, I feel up to it. Sometimes I don't. But if you've got the right mindset and the habits are in place, just the foundations in your mind is in place, it doesn't matter how you're feeling, you're going to always focus on your goal.
So for anyone who doesn't know you, you've had quite a successful bodybuilding career. What have been the highlight wins for you?
Probably my first competition, Mr. UK, back in 2010.
And we should point out these are all natural, right? So
yes.
These are not assisted in any way.
That's correct, yeah. Although there were people that were assisted in some competitions. But that competition there was like a defining moment for me, you know, because I discovered that there was a fitness industry which would accept me. You know, I just saw the fitness industry as it all being in magazines.
Right.
You know, I didn't know that I could become a part of it. So I decided I wanted to see whether I could become a part of it by going to photo shoots and competing. And when I won that show, it was like a stamp of approval. You belong here. So that was like really important to me. And then I went on to win some other shows, but that one there was like super important.
How many shows have you done, roughly?
Oh, Mr. UK, Mr. Britannia, Musclemania, Qualifier, Fame UK, the championship final.
So 1 or 2 then?
European. 7.
Is it 7? Yeah.
Yeah, okay. 7.
Are you going to keep going, do you reckon?
No.
Is this it?
Yeah.
I mean, it's
yeah,
good.
It was good. It was, you know, first it was like, okay, can I be accepted? Am I a person who would be recognized in the fitness industry? And I think I've done an okay job.
Yeah, I'll probably say so, yeah. So then, how do you then balance that career success with longevity in a fitness career?
Well, for me, it was like, it started off with performance. And then I thought to myself, I think it was like mid-30s, I was thinking, I'm not going to always look this way. I need to start focusing on like mobility and longevity. And then I started to incorporate more, started to look more intracellularly. Okay, what's really going on in the body? And just kind of using these two things in unison in my daily life, you know, thinking more about micronutrients, vitamins, minerals, as opposed to just macronutrients. Do you know what I mean? So trying to tailor my approach and try to even educate people to do the same. You don't have to be older to do it, but you start to think about that a lot more as you get older.
Yeah, I completely agree. I just want to double check that you've subscribed to the show because it really helps us continue these important conversations. Thanks. So to summarize then, it's a very successful, natural bodybuilding career. You're doing really well. And then because the Man Alive podcast is more around that kind of male aspects of health and everything, then obviously you get the whacking diagnosis of testicular cancer, which I think actually is a really useful thing to talk about, because when people look at you, they're thinking this guy is super fit. Like, you don't get sick if you're super fit. Why is it happening? So would you be happy to tell me about the journey that led you up to get that diagnosis?
Yeah. So I guess there were symptoms over a period of time which told me that something was not right. But because I've always been focused on optimal health and being superhuman and living past 100, I just thought to myself, well, I'm never sick, you know? And, you know, there was a few times I'd felt like sensitivity in my testicles. And one time I was showering and I did feel a lump. And this was like perhaps 8 or 9 months before going to hospital.
So when was this, sorry?
So in November 24, so last year,
right.
Just about a year ago.
Yeah.
That was when I had gone to hospital because of intense pain. But yeah, about 8, 9 months before that, I was feeling the occasional testicular discomfort, but it would come and go. And then I felt this lump and I just thought to myself, nah, I'm superhuman. This can't be me. This can't be serious. And I even tried to convince myself that maybe it's always felt that way. Yeah, that's always been there. I just didn't really pay attention. And then somehow, eventually, it just dissolved. It actually disappeared.
Oh, wow.
So I was, yeah.
Problem solved.
Yeah, so I was like, I knew it was all my imagination. And then the feeling would come back here and there. But also I was thinking to myself, there were times where I did feel, you know, testicular discomfort before, but it was normally if I needed to ejaculate.
Yeah.
You know, like if you don't ejaculate for a while, it's like, whew,
Yeah.
I need to let this out. So I thought, okay, maybe that's what I need to do. And there was times I felt better once, you know, I had released. So I thought that it was just like all in my head. And then eventually there was one day I started to feel some lower back pain. So it felt totally unrelated at all. And I was wondering where this pain came from. I thought maybe it was from deadlifts or some sort of...
Obviously deadlifts.
Yeah, right. I was like, how heavy did I go?
Yeah,
that's
obviously,
probably
yeah.
And, but I'm always like, my form is always on point. And I was like, how, like, at what point did that happen? And then it got to a point where I thought maybe it was my bed, because I only started to feel the pain anytime I was in bed at night. Like throughout the day, I'd feel fine. It was only at nighttime, around 10, 11 o'clock, it would just kick in.
Yeah.
And I thought it must be my bed. Maybe I need to change the mattress and get a new one. So that was what was on my mind. And then there was one time I was overseas. I was in Slovakia, and the pain kicked in again at night. So I was like, well, it can't be the mattress. But this time the pain was so intense. I just remember being on the floor, just curled up in a fetal position. Like it was so intense and it wouldn't go away. I was trying to move in different positions to hopefully get rid of it, but it wouldn't go. So I called the hospital, went to the hospital, and they done a few external examinations, couldn't find anything. And then they suggested to do an ultrasound. And I actually didn't really want to do it because I was like, this is going to cost me money.
In Slovakia.
Yeah, exactly. Yeah. I was like, this ain't NHS, but I was like, okay, let's just find out. So eventually we done the scan, and the guy was just scanning away. He was there for a while, and I was like, he's just trying to find something. There's obviously nothing there. Just give me some antibiotics and let me just get out of there. You know, so I was thinking in my head. And then I was like, have we found anything? And then he asked me to wipe the gel off, and then said and he was like showing me the organs and everything. He was like, okay, so this is your liver and pancreas and this and that. And he said, do you see this black center here? And I said, yeah. He said, it looks like you have a tumor. And I was like, tumor? It looks like. So in my head, it looks like. So it doesn't necessarily mean I do have a tumor. And then he said that we'll need to do a CT scan. I was like, man, it's going to cost me again.
This Slovakia, it's like £12.
No, it was about £1,000.
Oh, crap. Okay, I'll probably go home.
So anyway, done the CT and it was confirmed it was something, but they still couldn't tell what it was. They said they had to run some more tests.
Right.
But it was not until I came back to UK that it was discovered that I had cancer. At first, they thought it was lymphoma. They still couldn't figure out what it was. It was not until I kept telling them that I was feeling discomfort in my testicles that they were like, okay, we're going to do a scan on your testicles. And then they found some traces of cancer cells or something on there.
So the black mass, I assume, was a lymph node.
That's
that
correct.
Was swollen. And that was the key. What they thought was lymphoma, because it's coming from your lymph, but actually that was the drainage from your testicle, which was the primary.
Yeah, so it was the germ cell that had spread to the lymph node.
So I'm guessing, by the way you're sort of presenting this, that you're not somebody that's really accepting that cancer is a thing that you'd get because you're so healthy and I just giving the antibiotic. So how did you, what went through your mind when you're like, yeah, it's testicular cancer?
I felt almost like a sigh of relief.
That's not a common answer.
I know, right?
Yeah.
Because when they said lymphoma, I was like, that doesn't sound too nice. And then I had a look into it and I was like, yeah, this don't look cool, man. Okay, how did I end up with lymphoma? And then they said, like through the further tests, it's testicular cancer. I was like, all right, that's treatable.
Nobody I've ever said that has gone, yes, testicular cancer.
Yeah, for real.
I suppose.
Seriously, when they told me that, I was almost like,
wow.
Okay.
And that's because you knew survival rates were so good.
Yeah, exactly. Because by that time I was like looking at different types of cancer and I was like, all right, so this would be the best one.
Yeah, if you got to pick. It's like 98% survival rate at 10 years.
Yeah.
It's really good.
And, it was at stage 2 as well. So I was like, okay, get in.
Yeah. Again, right? No one says that.
I know.
But okay. So then that starts you on the path of chemo surgery. What was the next step?
So it was chemo, which was it was a 9-week cycle, which felt quite brutal. I'd never felt like that in my life. It was weird because when I was having the pain in my back, they said they were going to start me on chemo to shrink the size of the mass and it would get rid of the pain. So the pain went, but then this like disorientation and sickness feeling came in. And I couldn't figure out which one I preferred, And then I was like, do you know what? Give me that pain again.
Wow.
Because the chemo, it felt like I don't know. It's a feeling that I can't really describe. It was such a sickly feeling, brain disorientation, weakness. You can't speak very well. You can't move. And I think that's what led me to losing weight because I didn't want to do anything. I didn't want to eat. I lost my appetite. My sense of smell was just heightened. So when people were wearing aftershaves, it smelled really potent. In my head, I visualized them just buying bottles and just kind of dousing themselves, bathing in it.
Yeah.
And foods, the smell of meat smelled like carcass. And I just went off everything. I just couldn't eat. They showed me food. I was like, oh, it's disgusting. I can't eat that.
You do hear people, obviously most people have adverse reactions with chemotherapy. It's domestos to your immune system. So it really is killing stuff off. Yeah. And in a sense, it is quite archaic in that sense, but it does its job as well. Because I assume it did shrink the tumor.
It did. So, whilst I was there, I had to go in for the occasional CT and they were like, okay, we see progress. It's working. So
does that not make you feel like it's almost worth it then?
Oh, definitely. It got to the point where, when I went on chemo, my legs swelled up because they also learned that I had blood clots in my legs and it must have responded in an adverse way. And then I was in a wheelchair and it was just kind of wild, to be honest. I couldn't walk. But in my head, like when I was going for the checkups, there was progress. I could see that there was progress. So it just allowed me to just focus on the end result. Even though it was uncomfortable in the moment, I knew where I was heading to. So I was like, okay, I'm fine. I know what's happening. Every time after I had a round of chemo, the next couple of days, I'd be throwing up. And it got to a point where I was just like, I was so used to it. I'll be like, okay, let's get the bucket. And then vomit again. And then afterwards, just straight to the bathroom, brush my teeth. And it was just normal. I wasn't even uncomfortable anymore, you know? And I was like, right, this is part of the process. And then I was just becoming okay with it. And I was like testing my strength and resilience every day through trying to go for walks. At first, I couldn't walk. I could only take a few steps. But then when I was able to walk a few meters, it was like, there's progress, there's progress. I didn't know whether it was a mindset thing or my body just getting better, but I was just constantly working on progress. Even if it was behind where I was before, it showed me that the fact I was at the ground, but now I'm moving up again, I'm still moving forward, So I was feeling good.
What were other people's approaches or how they treated you when you had the diagnosis?
So many people were reaching out to me. I was like, wow, I forgot I even had your number. Why is it I'm hearing from you now?
Yeah.
You have to wait until I'm sick before you call me. And then it was like, it's interesting because the moment I was well, I didn't hear from him again.
Wow.
So it was quite interesting, When I've done a post about, I'll do a post about optimal health and achieving your own personal greatness. And there's certain people I won't hear from. But the moment I say I'm sick, I'm like, wow, like all these people I know is now commenting.
Yeah.
It is so interesting. So interesting. I don't know. I have mixed feelings about that as to how do people really care, or is it a generic response? I hope you get better.
Yeah.
But do you?
Well,
now I'm better. Like, where are you? Like, it's, I don't know, leaves me questioning a lot.
It's very interesting that how people approach other people's diseases and whether they feel they are truly supporting you or they're doing it to justify their own guilt, or maybe they feel they should have been a better friend or family member, whatever else. So it's really hard. I think it's difficult as well because when you're in the moment, you don't necessarily just want to talk about your illness and you might want to talk about other things in the world, but people always want to know, how's the treatment?
That's interesting. That's another valid point, because as I was going through it, I did want to speak to people, but I wanted to just talk about a different subject.
Yeah.
But I knew that they were dying to ask, and it's like, okay, let it out. It's fine. I know you want to know more. And I just got used to just like talking about it, going through the whole experience. But it was like, I wanted to know more about what's going on in other people's life. I don't want people to see me as the guy who's sick.
Yeah.
And, let me be your crutch if you need and do stuff for you. It's like, I'm good. I'm working my way there. Let's talk about some other things. It doesn't mean that everything else in the world should go on hold because I'm sick. Do you know what I mean? So that was something I had to try and navigate. I wanted people to know, I want to know what's going on in your life as well.
Yeah, I bet. But they're like, no, yeah, but tell me about you. How are you doing? That sounds like Meghan Markle's podcast. So 9 rounds chemo.
Yeah.
And then they go, right, surgery.
Yes, that's right.
Okay.
So after that was done, once it was successful, they said the contaminated area, to reduce the risk of it returning, we want to remove that testicle. Okay. So I had to go in again for a scan so that they knew which testicle it was.
That's always worth checking.
Yeah.
Like when they do orthopedics and they write a big arrow on the leg they're going to take off. You don't want to take the wrong testicle.
Yeah, exactly. So
orchidectomy's done. Take out the testicle.
That's it.
Do you have a prosthetic or just
no?
Nothing.
They asked me whether I wanted that, and I was like, "What, for aesthetic purposes?"
Yeah, for certain photo shoots. I don't know.
Exactly.
People may want posts. I don't know.
I was like, "What is the material?" They said it's silicone. I said, "No, I don't. No." I said, "If it's something else, I'd read into it and then possibly." But yeah, I'm not doing. Yeah.
Never really thought about
adult
what else
photo
would you want? Like, if not silicone?
I don't know. Like, I don't know.
Iron. Have an iron test at gold, like you would, like teeth. I don't know.
Exactly. You never know.
I hadn't
If
really
times
thought
are
about
hard, I
that.
can flog it.
I honestly have not thought of that. That's a very good point. Okay, so surgery's done, everything's closed up, and then obviously, this is where it gets, from my perspective, also more interesting. We've now blasted the crap out of your testosterone.
Yeah.
So we've taken away half of your testosterone production, but obviously you can produce testosterone just from having one testicle, and a lot of people do. And they do say it compensates remarkably well, a bit like, do you watch the A-Team in the 80s?
The A-Team?
With
Oh, it's
Dirk
been a
Benedict.
while.
The guy that played the face from that, I believe, has one lung.
Oh.
But it compensates so well for the lack he's missing the other, and the testicles can do the same.
Mm-hmm.
So, but it's chemotherapy that gets you testosterone, isn't it?
Yeah, exactly.
Did you
Exactly.
notice when it was affecting your testosterone?
Yeah, shortly afterwards, I wasn't. So when I had left the hospital, I was taking blood thinners for the blood clots, and I thought, okay, as long as I just get back to normal life, just continue with training and nutrition, then I'll slowly build up my any damages that may have occurred through the chemotherapy, and I'll be fine. And I'd go back to the hospital for checkups where they would, see my progress, ask me questions, see if I'm feeling anything, any kind of aftermath from the surgery. And everything seemed okay, apart from just feeling a bit groggy in the morning. I was like, maybe it's because of the surgery and I just need a bit of time to recover. But then I found that the grogginess started to become more and more frequent. And each time I went to the hospital and they were checking my weight, I'd noticed that, I'd lost loads of weight because of the chemotherapy. I was down to 91 kilos. And then I got back up to 103, which I normally would be at. And then it started to continue to go up. So I was like, okay, I guess that's a move in the right direction. But then I was like, okay, I want to sort of trim up a bit now. So I went back to intermittent fasting. But each time I went to the hospital, my weight still kept climbing up. And I was like, I don't get it. Like, why am I still gaining weight? So it was like 106, 109, 112, 115. I was like, what's going on?
And did you see physical changes as well? Like,
Yeah, I was looking in the mirror. I was like, why am I getting fat? To most other people, they're like, nah, man, you look buff. You look good. And I was like, no, this is not the physique I want.
Yeah.
And I noticed that I was snoring as well. And when it came to tying my shoelace, I was just heavily breathing, and it was a struggle. I was like, what? This must be because of the chemo. But then what I also noticed was that there was times when I was driving or I'm sitting down by the laptop, I had this sudden burst of heat come over me. Just my head would get really hot, and then I would just start perspiring. I would just start sweat, just dripping down my head. I was like, what's going on? Just random moments, just sweating and heat. I was like, oh. And this could also be out in the cold, like outside, all of a sudden, just start sweating. So I, decided to do a Google search, and it said that there was a sign of low testosterone. So then I requested to get it checked, and it showed that my test levels had hit the floor, basically.
Did you notice it in other areas, like strength-wise, though? Because the gym wasn't as affected, or...
Strength-wise, I noticed that my just recovery, and it was just my strength was still okay, but it was a struggle though.
Right.
It was like my head wasn't in it. I just couldn't connect with my muscle. It felt like I was, I don't know, pushing a boulder up a hill or something. Like it was really working against me. It made me feel like I hated training. I was like, why is this so painful?
Yeah.
It's hurting. My arms, everything was hurting. And I was waking up in pain. And it made me not want to go to the gym. But I was still going, just fearing the pain that I was going to feel each time. But the strength somehow was there. but it was really painful.
It's interesting, isn't it? Because you assume that testosterone equals muscle, therefore you must fail at the gym if your testosterone drops. But actually, I think we see in so many different populations of people with low T is that everyone's affected differently.
Yeah.
And clearly, you're genetically more gifted in having more muscle than the average guy, or maybe just from a history of training so hard for so long, probably both, just means that you have that resilience. But you just still go, well, if I took testosterone of this guy, he's going to lose all that muscle. But you didn't.
No.
Was sex drive affected?
Oh, yeah, absolutely. Yeah, penis didn't work. Like, in fact, I noticed through chemotherapy, morning wood disappeared. And I noticed that immediately.
Yeah.
You know, because I was so used to it and it was gone. And I was like, that's weird. I wonder if it's going to come back. And then after the surgery, I didn't see it. You know, I was trying to use the equipment, see if it would work. And it was like,
not the gym equipment.
No, not the gym equipment.
And certainly not that in the gym, because again, that's different video. Have a suggestion for a Man Alive episode or thought about something said in this episode? Comment below and I read every one. So what was the next step? You had a low testosterone diagnosis. What did they do with you?
So they referred me to a specialist that specializes in hormones, and they suggested that I'd need to go on to exogenous testosterone. In nanograms per deciliter, it was 92.
Okay.
Yeah.
Well,
and you know, the low level is normally like 300.
Yeah. I think you're like a quarter of what it should be.
Right.
So, yeah.
So they were like, yeah, that's really low. No wonder you're feeling like this, you know. And I forgot to mention drive, motivation. I had basic stuff. I had work to do. I just couldn't do anything.
Yeah.
I was like struggling to do anything.
Brain fog? Like fuzziness?
Yeah. Brain fog. And, you know, I'd have the laptop open. I'll look at it and I'm like, I can't do that. I'd be editing a video and I'm like, oh, I just can't think. I don't even know what I'm supposed to do.
Did you start to use caffeine more?
I tried caffeine, but I felt like it wasn't doing anything. So when I was in hospital, I kind of went off caffeine for some reason. The smell of it was like, it just was disgusting. So I just went off coffee for a while. And I think I tried a bit of coffee, but I was like, I just feel like I feel wired, but tired. You know, I was like, why is it just still not working? And I still feel broken.
How was your sleep?
Oh, sleep was disrupted. I was waking up during the night all the time. Oh, yeah. It was like just waking up, just sitting there like, why am I awake?
Yeah.
I'd try and go back to sleep. Then I'd wake up, go sleep. It's funny you ask these. Obviously, you're fully aware of the sort of symptoms. But yeah, like broken sleep, then waking up feeling further broken.
It's weird.
Trying to go to the gym, feeling even more broken, you know?
Yeah. It's because you imagine if you're absolutely exhausted, you can't train properly and you can't focus on stuff, surely a good night's sleep will fix that. So you must sleep better because you're so tired. But of course, because you haven't got any testosterone and you need testosterone to make estrogen, which is what helps you sleep, you're then not doing that either. So you're in this awful negative cycle where you can never get out of this, really.
Yeah, exactly. And when I went, you know, when I had the TRT specialist, I was given an injection to sort of like help to start the motor again. So it was like they gave me an injection, then they asked me to come back in a month, and then they were going to put me on weekly injections. I didn't even care at that point about fat loss. I just wanted to feel normal. That's all I wanted. I just wanted to be able to think. So she gave me the injection, and I would say within 48 hours, I was just feeling so much better.
Wow. I mean, that's really quick for TRT.
Yeah. It was like anything to lift me out of that grave, you know? It was like, I was just like, feeling like I can smile again. I just feel normal. I still feel quite fat, but I don't care about that.
Yeah.
You know, I just feel like I can think, right? I can just get on with some work. I can be mobile and do things. And I was like, right, okay, I can see where this is heading now, you know, if we continue with this. And then when I went back after the month, they then showed me how to self-administer. And it was pretty uncomfortable, and it still is to this day. But like when I'm thinking about the benefits which I get from it, it's just, I feel incredible, so much better.
Would you say it's more of a, for you, I mean, for you, we would presume this is physical, but actually it sounds like this is more of a psychological or a mindset improvement for you rather than a physical gain of being back?
Yeah. Because as long as my head was in the right place, as I said, like once your head is there, like everything else just becomes so much easier.
Yeah.
And, you know, I was putting on fat out of my control. Didn't matter what I was doing, intermittent fasting, eating one meal a day. And it just brought to my attention, like, I didn't really care so much about testosterone until I didn't have it, you know? And then it made me look into other men that could be suffering the same thing, you know, where they might be of a certain age and maybe because they hadn't been physically active like me, their test levels is probably through the floor as well.
Yeah.
And I'm like, wow, there's probably so many other guys going through this, thinking that they have depression when really it's just their test levels. Because I felt like, I didn't feel depressed, but I was like, man, I don't want to do anything. What's going on with me? Like, maybe I'm feeling depressed. I don't know. I just don't even know what I'm feeling anymore, you know? But it then brought to my attention, there's probably so many other guys who's feeling that without necessarily going through chemotherapy, just living their normal life. Well, what is perceived as normal to them.
This is the kind of message I try and get out all the time. So you're exactly spot on, really. I don't think we necessarily need to have the stark example of having testicular cancer or chemotherapy, because a lot of guys will kind of go, well, that's not me. So they may not have the night sweats or the hot flushes or something, but all those other bits you're describing are the sort of classic symptoms. But the problems we find are that a lot of guys in their maybe 40s or 50s are told this is kind of a cultural narrative that says this is normal. So if you're in your 40s, maybe you aren't exercising as much. You know, you've got one or two other medical problems. Maybe you don't have much sex with your wife. You've been married for 20 years. You've got young kids. Your job's really hard. So your testosterone does drop. But you don't think of it as that. Because a bit like, in that sense, until you Googled this, it's like, well, maybe it's side effect of chemo, maybe it's something else. You wouldn't think it's testosterone until you go, oh, it's testosterone.
Yeah.
So, yeah, no, I think it's a really good way of presenting that message to people to go, actually, this is more common than we think. And you don't have to have testicular cancer to have low T, because there's so much else that causes it, obviously.
Yeah.
So how long have you been back on the testosterone now?
Oh, trying to think when it started. So I had surgery in, I think, March, and then the following month.
It's about 7-8 months.
Yeah,
maybe.
about that.
And what's life like now?
Good. Energy levels is great. Focus is great. Feeling so strong. I feel like, you know, I test my strength just to see if I'm back where I was, and I've exceeded it to some degree with certain exercises, only because I'm testing myself to see, well, if I've got this stuff like, you know, streaming through my veins, then I should take advantage of it, you know?
Yeah, definitely. Well, yeah. Talking of which, it does roll nicely. We did do your blood test.
Okay.
And we did a massive set of health markers with you.
Right.
What do you think your testosterone level came back as? Bear in mind, so fit and healthy adult without testosterone, we'd aim for around 15 to 30 as the healthy range of testosterone.
I think it was 32. So I don't know, because it was like 35 and then went to 32 because we split the doses, because it was like one injection. Now I'm splitting it in two. I don't know, around maybe 32 still.
It's close. 28.
28. Okay.
Yeah. But that's great. And
that's good. Yeah.
And that's a normal rate. I mean, that's within normal physiology. So people that may say to you, oh, he's on TRT, so you just started taking bucket loads of the stuff to abuse it. Well, that's not the case, because we can see your levels consistently are at the upper end of normal. Yeah. Most blokes, even if they were super fit or not, probably aren't going to naturally get a level of high 20s in their 40s. Probably that's a decade or so younger, which is nice. But it's not going to do any harm, and it will improve your health overall. and you're within that normal healthy range. So the regime you're doing is perfect. It's really good.
Yeah.
I have to say, a lot of your bloods were pretty boring. There was nothing very much exciting in there I could nag you about, which is good, I guess we want to say that. It does show clearly you've got a lot of muscle mass, which is unsurprising.
Right. How do you see the muscle mass on the bloods?
So you can't directly measure muscle. You can measure a blood test for a thing called creatinine kinase, which is a breakdown of muscle tissue. And if you've got more muscle tissue, you have more muscle to break down, and then you pee that out. But you can see some of what's left in the blood. So you can pick that out as creatinine kinase. You can also get high CK in people that are really sick. So if, for example, you were 90 and bedbound and your creatinine kinase came back as high as yours is now, you go, they're in real bad trouble.
Right, got you.
For you, we know why it's high, and it's because you're training really hard. And that's great.
Can I just, on that subject, my creatinine levels did steadily go up when I had left the hospital and started the gym again. And the hospital had concerns about that. They thought that perhaps there was something wrong with my kidneys, because I think the GFR levels was something like 60 or something like that. Yeah.
So it's not a worry.
I'm aware, like I read into that, and I was like, that's why I suggested the cystatin C test, because it's a better way to check to see if my kidneys were fine. And the GFR was 87.
Fine. So just for those that don't know, obviously, but basically we measure your kidney function based as an estimated GFR, and that's called glomerular filtration rate. And that's basically an estimate of how fast we think you can pee out your waste products. And we measure what's in your blood. And if that's building up, then we assume that your kidneys have got problems because it hasn't peed it out. The problem with that test is it measures creatinine, and creatinine is a breakdown of muscle tissue. And of course, if you've got more muscle, more of it's floating around in your bloodstream. But that doesn't mean you've got kidney disease. It just means it's floating around the bloodstream. So you make an assumption that your kidneys are buggered, whereas actually it's just that you're training harder. So it doesn't always apply. Now, I'm not suggesting like this guy who's come back with high blood pressure and diabetes and cholesterol and goes to Greg's for his lunch every day. You can go, oh, I'm pretty chill. My kidneys are fine. You're like, no, you are screwed. But for the other guys who understand why their levels were altered, for you, it's not a worry. And you're right, you can do more sophisticated tests to be sure as to why that's happened. But people do worry. They're like, oh, my creatinine's really high. So I've got kidney disease. And you're like, well, all these sort of things in medicine, you have to put in context. So yeah, I'm not worried about that at all.
I think it's very important for people to be aware of that as well. So, I think doctors can make people get alarmed over this and perhaps even end up on medication because of the wrong diagnosis, potentially.
So one of the ones that we do check is luteinizing hormone. And so LH obviously is the hormone that's produced in your pituitary. It tells your testicles to make testosterone. And prior to your TRT, I would imagine that LH would be quite high.
It was crazy.
Yeah, because obviously we've just taken away a testicle and the chemotherapy shut down your own testicular production. So your brain's going, seriously, I need some testosterone. So the LH goes really, really high. Then we give you exogenous testosterone and suddenly the LH goes, well, I don't need to do anything anymore. So it tanks. Yeah. And that's a normal thing. I guess the question for you would be whether you ever considered or discussed the idea of testicular preservation treatments with your testosterone, or just like, I just want to be on TRT. I'm not fussed. I'm not having any more kids. It doesn't matter.
Yeah, they discussed that with me before even chemotherapy, which was good.
Yeah,
you know? And they said, yeah, would you like to, freeze some sperm? I can't remember the term they used, but I was like, no, I'm good. I've got 3 kids. I don't need more. I'm good.
So you were definitely, I've done my bit for society.
Yeah. It was almost like, is this a promise that it won't work? Like,
yeah. It's not a guarantee. Yeah. So yeah, I mean, for some patients, that is a deal. And we do say to them, yes, testosterone is the key treatment, but maybe you are a bit younger, or maybe you haven't finished your family, in which case we do want to keep that LH moving, and we do want to make sure your testicles can still produce sperm for some men. It's not the be all and end all, but I think the idea that it's just that or nothing, we need to start getting out of that idea, because there are other things you can do for treatments as well. So just to be aware. I mean, obviously yours will be suppressed and it doesn't matter because you're not going to have kids. And I guess the other argument is for you, the TRT is lifelong now, isn't it?
That's it. Yeah, it's a lifelong thing. They said I've got hypogonadism. So
Yeah.
I don't know whether there's like some reversal of that at all. But I'm like, as long as my bloods are in the right place, do I really care about coming off it? I don't think so.
Hypogonadism is the medical term for testosterone deficiency.
Right.
The problem is that no guys like to be told they've got hypogonads. Doesn't have that same sort of
I know,
ring to it.
hypogonad.
Yeah, you got a hypogonad right there, and you're like, I don't want that. So we just call it testosterone deficiency. Is nicer. But I guess the argument for you is, even if you had some return of your testosterone, it's never going to be high 20s again.
No.
Because, well, first we've taken away half of your testosterone producing equipment, and even if the other one can compensate to some degree, is it ever going to reach that? And chemotherapy, we're pretty sure, does some pretty longish lasting effects. And you're right. So if you can get around that mindset of going, well, actually it's an injection twice a week, but it's okay, and your long-term health is now suddenly so much better, why would you come off?
Yeah.
I think one of the big worries or concerns patients have about TRT is they're like, well, what if I want to come off it? And they're like, well, you can, and your body will probably go back to what it was before. But if you're feeling better and your energy's better and your sex drive's better and your mental health is better, and we can say to you, actually, your risks of other things like diabetes, osteoporosis, and loss of bone mass and muscle mass and improved cardiac muscle, all that's going to get better. Like, why would you come off it?
Yeah, exactly. And when I was looking at the increased risk of cardiovascular disease with it being low, I was like, hey, just give me the injection. Do you know what I mean?
Just pass it on. So you're quite happy with that process now?
Yeah. I've come to terms with it, and it's fine. You know, I just see it as a benefit, really.
Yeah, I think that's a really good way to think about it.
Yeah.
Do you have a mate who's going through a rough patch right now? Share this with them today, because one conversation can change a life. Yeah. So looking back through the whole journey again, what do you think the experience taught you about masculinity or being vulnerable?
Being vulnerable, masculinity. I think masculinity is just in the head. It's just in the head, how you feel about yourself. And when you're in that vulnerable state, maybe you might feel there's not much you can do as a man, you know? I was being wheelchaired around. Even when I was going to the hospital, I had a driver come and pick me up, and I had to lean on his shoulder as he held me.
You must have been really pissed. You're really heavy.
Yeah. It was funny because I needed help going to the toilet when I was in the hospital, and there was like some really skinny dudes. I was like, man, you're not big enough, bro.
It's nice because you could give them deadlift advice while they're helping you to the toilet.
Exactly. Your form is off.
Yeah. But yeah, I think you're right. The mindset thing for you is the key, isn't it? The medical stuff is the stuff that saves your life or gets you back on track. But without the mindset, you're not going to get back to where you were.
It's so important. And that's the thing that really got me through all of it. You know, just setting little targets every single day. I remember trying to do some push-ups, and, you know, I'd normally do around 75 push-ups, but I was down to 3 on my knees and my arms were shaking, you know? And then I slowly progressed up to 10, and then I went onto my feet to do it, and I could see the progress. So, you know, setting these little goals just helps you to remain focused, looking further ahead. It's like, you know, you can't drive looking in the rearview mirror thinking about what's happened in the past. You need to really look ahead and keep the focus. And I think that's what really kept me going.
Were there times when you pushed too hard in your recovery, had to slow down a bit?
I immediately, to be honest, I wasn't supposed to go to the hospital whilst I was in the hospital. They wanted me to stay on site, but I actually sneaked out and went to the gym. Yeah. I don't know if they're seeing this now, but hey, no, yeah. Like I was just like, you know, sort of stumbling, and I went to the gym. I was like, I can't just stay in this bed. Like just walking around, because if you think about it, it's like you're in a ward with like all these other sick people, and all you can think about is sickness. You know, everyone's got, you know, tubes in their nostrils, everyone's coughing and crying. And there's one guy on my left-hand side, he was soiling his pants like every day, and it stank. Then there was a guy on my top left, I think he had Alzheimer's, and he was talking to himself during the night. He kept screaming during the night, saying, "Where am I? Who are you? Why are you in my house?"
Which gym is this, sorry?
What gym?
Oh, no.
The hospital.
Oh, still got it. Yeah,
and then it was the dude right in front of me. He was running around naked during the night. So I just needed time to get out the hospital. And I felt like I needed the gym.
You snuck out to the gym?
Yeah, literally. They said, you can't leave. And I was like, yeah, I'm just going for a walk around the hospital. And I went to the gym.
In like a gown and a drip?
In a gown. In a gown.
In a gown.
Yeah, I didn't care. Did not care.
I feel like there's a whole podcast we could unpack on that one. Can you imagine being at the gym and there's some jack guy with a gown on with an open back, just doing deadlifts again? You're like, oh God, I don't want to see that.
Oh.
Remind me not to go to your gym. So, I mean, it's a really positive thing overall, isn't it? That mindset, even then, is still, I'm going to be healthy. I'm going to push this. I'm going to push this.
That was it.
And then now, what's your view now on longevity?
I mean, it always has been customizing your approach. A lot more blood work, for sure. I was doing blood work and then I just stopped for a bit because I'm like, I'm good. I'm fine. And then that was when I fell sick. So I would suggest blood work is like one of the pinnacles in terms of checks. Like you can get everything, all your markers there to see where you can make little improvements here and there. If there's deficiencies, something which is a bit low, yeah, you can look into nutrition or supplementation to bring it back up. Sometimes it's activity levels. If that's too low, then improve it. Just customize your approach and keep at it. If you're interested in longevity, that is. Stop trying to think about patching problems, waiting until it's too late. I think lots of people have that approach. Well, I'm not sick, so I don't really need to think about that. No, the goal is to avoid the thought of that in the future. Like, think about optimizing your health so you don't need to think about sickness at all.
No, I agree. I mean, when we do these bloods with you, for example, we wouldn't have picked out primary testicular cancer because it's not an easy screen you do as part of a health check. But you probably would have picked out other things are abnormal, like your full blood count and your white cell count, hence they thought it's lymphoma. So you probably could have said, well, something's not right. And then you could go digging and find it out more from that. So you're right, even if you can't have a test for everything, but having that mindset to say, well, if I'm just regularly tested and I'm looking after myself and I listen to my body better, could I do more things to prevent? Although maybe that's the argument of feeling a testicular lump. If you could say to other people in the world, what if you're going to become potentially, and you may not choose to do this, but you may not have a choice and you may become an advocate for testicular cancer.
Right.
What would you say to other guys out there?
If you feel a lump, then definitely get it checked out immediately. And just check. Chances are when you're showering, you're going to have your nuts in your hands anyway. So just have a little fondle. If anything feels, peculiar, get it checked out.
Yeah.
Chances are a high chance if you catch it early, it's just surgery. I know it sounds a bit aggressive or brutal, but it's if you think about it, having surgery is better than going through chemotherapy.
Yeah.
It's just like, you focus on the one point, cut it out, throw it away.
That's about as technical as I reckon my surgical mates are. So yes, I agree. I completely agree. And the difficulty is people will watch this and go, yeah, I totally agree. But a lot of guys will still go, I don't know. Maybe I noticed something, maybe it's okay, because it's still an embarrassing thing.
Yeah, of course. You're going to, okay, so one thing I omitted was there was a time when I was like, do you know what? Let me get it checked out. And I booked an appointment at the doctor. And then I had a job that came up. I canceled the appointment and I never went. I never went. Dude. And I convinced myself it wasn't important.
Oh, man.
Yeah. So, don't let anything hold you back. If you feel you're unsure, just get it checked out. They'll have a quick fondle as well, if you don't mind that.
We don't just do that, by the way.
We do that, yeah? Okay.
Slightly more technical, but it's fine. It's fine. I'm going to ask you one more question about the testicular cancer thing, because I touched on this, but how do you see yourself presenting the image of what testicular cancer is and the treatment and how you could be that face of testicular cancer in the future? Is it something you even thought of?
I wouldn't mind that at all, to be honest. I wouldn't mind talking about it. And how do I see testicular cancer?
Well, my reason is that the one thing we really lack in male health is men's health advocates. So in female health, it's everywhere. And menopause is a really good example. We had TV shows and we've had people like Davina McCall who've done brilliant documentaries around menopause, and it's really raised awareness. Guys, we don't really have many. We've got a few guys doing some stuff about mental health, which is brilliant, but physical health is often really stigmatized still. And if you have a guy who's suddenly had a really interesting journey around a personal problem, and testicular cancer is one, you might then be called up to say, actually, this is a guy that we could use as a great example to say, yeah, go, as you said, check your nuts.
Yeah. I'd be happy to do that. You know,
it's a good thing.
And to be honest with you, it's a weird thing to say, but it's not as scary as people might think.
That's good. I think people, if they can see you've come out of it and you've done all right, and it wasn't as awful as you thought, and you survived it and you had a really positive mindset, I think that will hopefully make people think maybe I could get it checked, or maybe it's not something I just need to bury my head in the sand about.
Exactly. You get it checked early. It's like you can have surgery and done within a few hours. Back home watching EastEnders.
Back home, bench press in the afternoon.
Yeah, exactly. I actually had someone DM me and share his own personal story. It's like, you know what? Even my family don't know, but I had testicular cancer. I had it. I caught it at stage 1, went to the hospital, got it removed, and then went back home.
Wow.
Yeah.
That's crazy stuff.
Yeah. So you catch it early, and it's, make it seem like it's a simple thing, but really it kind of is. Obviously there could be a restriction in the amount of testosterone you produce, depends on your health, but it's better than having cancer and dying.
Yeah, I completely agree. What frustrates you about men's health culture?
I don't know. I don't feel like there is one, to be honest.
That's a problem to start with.
Yeah, I think there's a lot of maybe egotistical approach to just men in general, but I don't feel like there's a proper men's health culture. I don't see it.
How do you feel that men in society now fit, maybe compared with when we were kids, or or maybe what our dads had at that age? How do we fit in society now than 40 years ago?
I don't know. With the dawn of social media, I think a lot of men feel like they have to uphold to all these different images. I think when we were younger, we would just perhaps look at our fathers, grandfathers, and we would probably just try to be a stoic figure of some sort, whereas now it's a bit more egotistical and pretentious. Less genuine. And I think that in itself can just cause a lot of pressure on men to try and uphold these types of images which are not achievable.
Yeah.
I think that's it, really.
Of course, there is an irony in that most men are not going to achieve your physical attributes on social media, but that's not the point. And I guess the other argument is that you've done it for how long now?
Oh, it's over 30 years.
Yeah. I think, as we touched on at the beginning of this, if you're 22 and you're absolutely jacked giving fitness and health advice, I'm kind of like, is this the guy I really want to listen to? I don't know. Probably not.
I don't know. It's a tough one. It's a tough one. They might be able to give some people it's like, I'm going to gel with some people, and maybe this 22-year-old will be able to gel with different people as well. They've got a different audience. They're going to speak a certain language that these people understand. Everyone picks up things in different rates and different types of languages, and we're just going to gravitate to different people.
Yeah.
So,
when you put it like that, I fully appreciate I'm now in that middle-aged group, cynical, largely grumpy, can't understand the words that they're using. Like when someone says to me, that's sick, I go, do you mean you're actually sick? Because you're talking to the wrong person about this, which always winds me up. So yeah, you're probably right. I mean, I guess it's the right person for the right medium. But again, when we were kids, we didn't have that massive influx. There's just so much information presented to you now. It's hard to know what to take from that, because most people would have bought a copy of Muscle and Fitness or Flex or something. Yeah. And they'd see you on the cover and they go, right, I can do that in the gym. But now there's a million people out there. And how do you know?
Yeah.
You feel like you should never, I don't know, I feel sorry for my kids, because I feel like they're going to watch social media and they're going to see these images of what appear to be just thousands of people out there with infinitely godlike bodies. But not everyone's going to achieve that. It's not really a question. It's just my rant.
No, but I feel you. It's a labyrinth to try and navigate through with the amount of information that's out there. And sometimes it's a case of trying something, experiment for a little bit and see how it works for you, or if it works for you. Yeah. If it doesn't, then move on. You have to be very introspective on every single decision that you make. Some people, they don't stick at anything long enough to actually see if it works for them. They try it, maybe after a few days, they're changing, they're switching over, and they're just trying to see who's got the most followers on social media. If they've got the highest, then they must know the most, And, you've even got people who they've got a coach showing them what to do, and then they go to someone else asking them advice on stuff. I've had people come to me asking me about certain nutrition, and I'm like, but I've seen you with your coach. Like, what advice have they given you? And then they'll tell me, and I'm like, well, listen to them. All right. I'm not going to give you anything else. Listen to your coach. And if it doesn't work, then let's talk afterwards. Yeah. So you got a lot of people, they're just trying to run around and find something new all the time. And with that sort of mentality, you're never going to be able to, it's like an unstable relationship going around and just sleeping around, you're not going to.
Which we wouldn't do or advocate, obviously.
No,
so,
exactly.
Okay, what's your top 3 checklists to sort of optimize male health? If there are 3 things that are sort of the basics you would recommend.
To optimize male health, resistance training, sleep, and nutrition.
Simple stuff, isn't it? But you hear this all the time. But people want a quick thing. They want something that's easier than that.
So true.
Is there one thing that you could say to somebody watching this who maybe isn't sure where to start on their journey, but what small change could they make today?
Just start somewhere. I think that's it. I think sometimes people try to have all their eggs in the basket, and it's like, no, you don't have to have it all figured out straight away. Just start. Even if it means going to the gym once a week, or if it means to change the foods that you're buying from the supermarket. You don't have to change everything all at once. I remember when I first started PTing and a guy wanted to change his diet, he was just eating trash, absolute trash for food. So I gave him a whole new eating regimen and he failed miserably. And I realized it happened because it was such a complete change to what he was used to. And I needed to take it step by step with him. So I was like, all right, continue with your trash, but we're going to make a few modifications here and there. Let's just have a healthier breakfast in the morning. Can you do that? Yeah, okay, I could do that. And then we slowly built up from there, healthier eating styles, healthier sleeping patterns. And yeah, that's what it takes really. Just a step-by-step approach. Stop trying to do everything in one go.
Nice.
That's the sort of advice I would give.
Okay. So last question. How do you think your health journey, your change in life from fitness through illness has changed you as a person and as a coach moving forward?
Well, it's made me look a lot more into hormones. I've realized that well, it's not until mine was affected that I started to look more into that. I mainly focused a lot for men on their body composition. And once the body composition was in place, then, you know, the, insulin sensitivity is going to improve, less chance of having any kind of metabolic disease or cardiovascular issues. So I was mainly focusing, if the composition is in the right place, then everything else will kind of fall into place. But I started to focus a lot more on hormones. So I'm looking into people like clients' hormones now to see whether they're fighting an uphill battle. So it's a lot more interesting, to be honest with you. And now I'm questioning, okay, what's your energy levels, and just looking into symptoms of potentially low testosterone. But from my experience, it has allowed me to appreciate to so many things in life. And it made me, I've always appreciated life, which is one of the reasons why I always wanted to live till 100 and focusing on doing the right things to achieve that. But I've always... One thing I've started to think about more is be more like, make decisions and do it. Don't plan too far ahead. Sometimes you just gotta just do things earlier. You know, I'm taking a lot more trips now. I'm just gonna do it. I'm not gonna think about it for too long. I'm not gonna analyze it and think, okay, maybe in 5 years. I'm just gonna do it as quick as possible. There's expressions. One of them is like, feel the fear, but do it anyway. Or jump from the hills and grow your wings on the way down. So it's like, even if you don't feel ready, just go for it.
Yeah, I like that.
You know, it might feel uncomfortable, but you'll figure it out. You will figure it out. You know, because life had put me in a really difficult position, but I figured it out. And I thought, there is nothing harder than that I can go through.
That's so beautiful. Yeah, that's good. Thanks. So thanks so much for coming on, Man Alive. It's been brilliant to have you. If people want to keep up with what you're doing, or find out where you're on social media, how should they contact you?
Oh, well, I use Instagram a lot of the time. Sometimes I'll put up some Q&As, so you could always throw a question in there. So Instagram, @RogerSnipes. I'm on X as well, Roger Snipes. Facebook, Roger Snipes. I do have TikTok, but I never use it. It's just too fast paced for me. Maybe I'm old. I don't know.
That's brilliant.
I see it, I close the app.
Brilliant.
But yeah, Instagram is probably the best place.
Awesome. Well, thanks again. Thank you very much.
Thank you. Thank you.
If you enjoyed this episode of Man Alive, you would love this one. Go on, press it. Click now. Press it now.